Okay, I'm Caitlin Heredia, I'm a PA, and I'm going to be talking today about adopting a trauma-informed mindset. This is inspired by my Leadership College project, which was a bit more focused. It was on the Trauma-Informed Pelvic Exam and providing education to improve healthcare outcomes and positive patient experiences. So if I were to ask everyone to raise their hands, I won't, but if I were to ask you, have you experienced trauma in your life? Whether or not you know it, you would need to raise your hands because we've all experienced some form of trauma in our lives multiple times over. Those traumatic experiences can be more severe than others, certainly, but they can still have a great impact on us whether or not they are deemed as more severe or not. So, an example of trauma, you can have your lunch stolen from you, which happened to me in 5th grade. You can, have a car accident, personal experience again, hydroplane, my favorite beloved first car, into a tree. And those are all traumatic experiences. I bring those things up because I know that not all of us are necessarily in practice currently, and not all of you are, even if you are in practice, not all of you are doing pelvic exams on a day-to-day basis. So I wanted to try to make this talk a bit more relatable to the broad variety of population and help you hopefully to recognize the value that being trauma-informed is going to be important in caring for our patients or others, as well as being more compassionate toward ourselves. I don't have any financial disclosures, but we will be discussing trauma, and although we won't be discussing any traumatic events in detail, I understand that there are various sensitivities, so if there are any concerns, feel safe to leave if needed. So based on current CDC data, over half of women have experienced sexual violence in the form of physical violence in their lifetime, and maybe even more surprisingly, about 1/3 of men will have experienced that same thing. And there are really very significant consequences of sexual trauma, and many of these can be related to other forms of trauma, other physical trauma or emotional trauma as well. But for instance, acute physical harm, mental health concerns like anxiety, depression, PTSD, even suicidal ideation. Sexual trauma is associated with increased rates of higher risk behaviors like smoking, alcohol, and drug abuse. And we also see a correlation with sexual trauma and physical health conditions that are even chronic, like pelvic pain, menstrual problems, and sexual dysfunction. There is a potential for people to avoid the medical community if they've experienced trauma in their past, and social withdrawal, so from family or communities, as well as the risk of sexual trauma contributing to loss of time at school or work. And interestingly, one source I found estimates the financial burden of even one sexual traumatic event for a person to be over $122,000 in their lifetime. And that is thought to be related to loss of time at school or work, so lost money there, or legal fees, those kind of things. So I didn't actually start out in my project to research and learn more and educate people on sexual trauma. It started out as a project that I wanted to educate people on cervical cancer and increasing cervical cancer screening rates. And as I was doing that, I realized that, at least for me, the more urgent need that was at hand was to go more into the pieces that maybe prevented patients from coming in to see me or that made them hesitant to seek care. So, I initially identified pelvic exams are really important for preventative care as well as for identifying disease and gynecologic illness. We know, and anyone who's experienced a pelvic exam in their life probably would say they're not the most pleasant experiences, and we're gonna, we see a lot of people dislike them and don't exactly aren't eager to go. Pelvic exams, though, for people who've experienced sexual trauma may be even more distressing, or someone may be more likely to avoid them if they have experienced sexual trauma. So again, as I was discussing with my patients and trying to be more cognizant, I just recognized patients becoming or showing me more that they really needed that extra care. So to zoom out a little bit, what is having a trauma-informed mindset? So this is going to be relating to, again, medical practice, as well as hopefully relating to just general life as well. But most simply, a trauma-informed mindset is avoiding re-traumatization. So if someone's experienced abandonment in their life, then it's going to be helpful in your relationship with them, whether that's personal or professional, to make sure you communicate with them thoroughly. You're letting them know your plans. You're including them in your plans. Also, we'll talk about this more a little bit later, but treating everyone with a trauma-informed approach, and avoiding making assumptions about the person. So, some people actually don't want to discuss their trauma, and I've come to learn that they may not want to really even engage about it, but they want you to maybe recognize and be sensitive to their needs through it, though. Keywords: autonomy for the person, acceptance, giving them a physical and emotional safety, and collaborating with them is important. It's also important for us to reframe our self-centered mindset and consider the goal at hand. So, for instance, as a medical provider, if I'm going to do 3 pelvic exams in a row, not a big deal to me. That's just my work day. Well, what if that pelvic exam was the first, my first pelvic exam I was doing of the day is someone's very first pelvic exam, and to them it's not just routine. So trying to zoom back and consider, how is this person experiencing it? And then looking at the why behind someone's behavior or their fear, and not just trying to diminish it. We recognize that all of us have been through the pandemic in the last 2.5 years, and it's again, we've all experienced some form of trauma, so being kind to ourselves and each other is probably a good goal that will be relatable to all of us. So kind of honing back in on my project a little more specifically, I wanted to talk about what I did more in depth. So my project was especially focused on increasing education around the trauma-informed pelvic exam. So really educating providers on how to use the trauma-informed mindset when doing pelvic exams. My project is based in a university clinic, and our average age of our patients are 21 years, but the range is usually between 17 to the mid-40s. And so what I thought was really interesting about this population and this project is that, one, many of the patients or students who are coming in for care are potentially presenting for their first time independently to get health care. So it can be a scary situation. They're maybe having their first pelvic exam. And if they've experienced sexual trauma, it may be more recent if it was, say, in childhood, which a lot of studies show that sexual trauma occurs especially in people's childhoods, versus if we're talking about people in their 40s and 50s, which may be more a remote experience, and maybe they have processed the trauma and aren't as affected by it anymore. So I did create a training and an educational session on trauma-informed pelvic exams for medical providers, and I administered a pre-training survey as well as a post-training survey to gauge what the providers were doing beforehand as well as after the training was done. And this was implemented within my practice. I also, kind of as an aside, surveyed non-university patients. So this is like in the community, not within my practice, to understand kind of the patient perspective. And I will say I was hoping to survey the students and patients within the practice I serve, but unfortunately was not approved to that. So I still felt like it was going to be valuable to obtain that information from community patients, and I really did find it was valuable. We'll talk more about that later. Some ongoing efforts are to train other medical professionals within our practice, to include nursing staff, and also including the training for other practices. As just one piece of data that I wanted to pull out that I thought was really interesting was Here you're looking at two pie charts, and if just looking, you may not even be able to see the numbers very well. If you just glance, the two pie charts are relatively similar. What you're looking at is from this community patient questionnaire, and it is looking at the patient comfort with pelvic exams. So on the left, there's those who have experienced a history of sexual trauma. On the right is those with no history of sexual trauma. And if we look at percentages, it's 53% are somewhat comfortable with pelvic exams, those who have not experienced sexual trauma, and then 40% are somewhat comfortable with pelvic exams of those who have experienced sexual trauma. These percentages are not vastly different. Now, I will say the community survey participants, it was a group of 56 people. The majority reported no history of sexual trauma. So there was, looking at that number, that about 50% of people having experienced sexual trauma in their lifetime. This is not greatly representative of the true population. And also a large number of the people who responded or reported having a history of sexual trauma, their trauma was more than 6 years ago. So I think if we had a broader range of participants representing a broader experience, it may be different. But what I gained from this was that ultimately it's probably best to assume that everybody could benefit from being treated with a trauma-informed mindset, because ultimately those who reported no history of sexual trauma, still a large majority of them don't feel completely comfortable with pelvic exams. Some additional findings, again, from the community patient survey, out of the 56 people who were surveyed, 84% of them, so 47 of them, reported that they did not have the provider ask them before the pelvic exam whether they had any concerns about the pelvic exam beforehand. Interestingly, when I surveyed the providers in my group, 62% of them reported either always or most of the time asking their patients if they had concerns. So I think ultimately my providers in my group are fairly well trauma-informed. I found in the pre-survey they were already doing a lot of practices that were trauma-informed, so they may not greatly represent the large variety of providers in our community, but it was still helpful for me to see, and actually really surprising that patients in the community just really weren't asked often whether they had concerns before doing such a vulnerable exam. And again, I did note that in the survey, many providers actually were performing with a trauma-informed exam principles, but they didn't have formal training in their education, and that they may have kind of gained that throughout their own research or just over time and experience. During our training session at the end, we actually did identify a need to increase or improve patient autonomy, even in other areas, not just in the pelvic exam realm and gynecologic care realm. So that was a really nice outcome as well, where we were able to talk about patients coming in and having the choice, for instance, to sit on the exam table or in a patient chair. So for goals and future plans of this project, I would like to create trauma-informed gynecologic care materials for patients as well. That would include, particularly in my patient population that does love the social media and everything, having videos that maybe are embedded in the website or on social media that kind of explain what trauma-informed care is and how patients can be more autonomous and advocate for themselves and their care. A part of my project that I was hoping to accomplish and was not able to was to actually do training sessions in this university-based clinic and reaching out to minority groups, graduate schools, athletic teams, and doing sessions for them. So it would be, an exciting thing to be able to do that in the future. I also, again, would like to continue to educate other medical staff like nursing assistant or nurses and medical assistants, and then also providing training, the trauma-informed pelvic exam training for other medical practices, including family and emergency medicine, as well as OB/GYN. And then really trying to promote the idea of implementing a trauma-informed approach as a universal precaution. So many of us think about our universal precautions of, hand washing and using our personal protective equipment, but there's an AAFP article by Ravi and Little, and they actually kind of coined this idea, and I really think that's a great idea for us to consider. So I briefly mentioned earlier that when I was in 5th grade, I had my lunch stolen from me. And, why did that stick out for me, in my mind for more than 2 decades? Why do I still remember that? And why do I still even remember this girl's face once I realized, who stole my lunch? I experienced trauma that day as a 5th grader. I mean, now I can look back on it and say, it's not really that big of a deal. It was just my lunch. I wasn't harmed. But when we are in a certain mindset, or when we're in a different stage of life or a vulnerable place, again, these traumatic experiences can really have an effect on us. I think that now that I look back on it, I actually think about the girl who stole my lunch, and maybe what brought her to need to do that day? What kind of, maybe trauma was she experiencing that she needed to look for some food to eat? And so, again, that's through experience and growth and learning. And I think we could all benefit from thinking of that more in our day-to-day. Why did someone cut me off on the highway? Well, maybe there's a reason for that we should, instead of honking our horn, think about it for a second. That's an example. But, just kind of being able to see the bigger picture. And so this is just a quote that we think of, and if you've heard much about trauma-informed care or a trauma-informed mindset, it's really going from the thought process of what is wrong with you to what happened to you, and just trying to understand where a person's coming from and our relationships, and working with them, supporting them. So thank you for your time today. I'll take any questions.